So for today, we can focus on self-testing. Self-testing, the first is oral quick. You can use oral quick, you can use one for, then sure check. Then there is determine, there is BioLine and StatPack, and then PCR in advanced laboratories. Now, you can also use PEP to prevent yourself from HIV. So self-testing helps us to know your status or your partner's status. So you can begin with the oral quick for using the saliva or the oral fluid. Then you tear from the weak points after getting the kit. You tear from the weaker points, which are two on opposite sides. Then you remove the inner contents. Remove the inner contents. After then reaching inside, there is also another pack which contains the oral quick and also the buffer. Then there is an envelope. There is an envelope for putting the test strip and present to your healthcare provider. There is also a stand for putting the buffer for reading, as we shall be seeing ahead. It also contains, then you throw out the covering or the packing because it is no longer useful, it is useless. Therefore, there is also what we call the guidelines. Then there is also the guideline, as I had showed you earlier, that the other stand you put it on a firm surface, on a flat surface. Now the guidelines are for you to read, follow the steps step by step. You follow step by step. You can either use an illiterate person to help you, or you can use a healthcare provider to use them. And the inner packing you also tear. It also has the weaker points. You tear to access the inner contents. Now on opening, you will see that there is another container which contains a fluid, and for this fluid is what we call a buffer. Therefore, this one is a buffer container. Buffer container containing the buffer. Now you also pick your stand. Then you remove the top, the top covering. The top covering. After removing the top covering, then you place that buffer container onto the stand firmly, very well. Then after placing it, you put it on a flat surface, on a flat firm surface. Then you tear the other side which contains the test strip or the test kit, which is spoon-like. You can throw away the other covering because it is no longer. Therefore, the thumbs hold the other screen. After then you pass the other spoon-like thing onto the jaw inside, up and below, upwards and then downwards. Then after, then you place into the buffer and wait for about some minutes. Then you put your timer. You look for a timer. You can use a clock, you can use a watch, you can use a phone, as long as the timer. You time for about 15 to 20 minutes. 15 to 20 minutes as to read. It is somehow slow. It may move slowly, but you have to be patient and wait for the results. Don't need to rush. So you can go to sure check. Sure check uses blood. It doesn't use fluid like the previous test. It uses fluid. So you open it. It also contains another covering packed inside. Then you can use it after. Then there are also other things like the swab, the alcohol swab which is wet. There is also another guidelines, as you have seen. There is also another stand which is colorless glass-like. Then you can throw out the other covering because it is no longer useful. It also has the guidelines. It has the guidelines for helping you, for assisting you, follow step by step for an accurate result and good result. Then you read it whenever you are stuck. Then even if you can read one by one. Therefore, you tear the other packing. The other packing contains other contents. It also has other contents for helping you to test. It helps you throughout the procedure. So that one is also test. Then that one is a pricker. It has a pricker collecting blood. For this one, it is a sticker for closing the pierced area. Then this one is also a test strip. Then there is a an alcohol swab. You tear to access the inner wet part. Now after you throw away the other covering, then you clean the other ring finger, the ring finger. Then after cleaning the ring finger and the proper side, the outer part of the ring finger, the outer upper part of the ring finger, then you pick your pricker. Then you remove the top part, the covering, then you throw it away. The other part which was covered is placed firmly on the other part which you had cleaned. Then you press it firmly, you push it very well. There is a pricker inside, it will prick you worse and slightly. Then you press your finger to get enough blood sample. As you get your blood sample, you can remove, you pick your other screen, the other part, the other container, so that small blood will enter into the other content, which is commonly known as a strip. You can pick it, then you can pick it. Then on side the other part, there is also another part which is top on the top covering. It contains another fluid which is the buffer. Which is for the other thing which is removed from the other is placed there, which is like a top, is placed inside the stand, and the paper like faces up. Then you place the other side which you put the blood firmly, is placed firmly, and wait for and put on a flat surface and make it upright. Then you wait for about 20 to 15 minutes. You also have to be patient. The blood will flow upwards with the sample, and it will be reddish in color. It will be reddish. Therefore, you can pick the other part which contains the gauze, gauze pad. The other gauze pad is for cleaning that excess blood on your finger, which can also be thrown away. And very well, there is also the other sticker. The bandage sticker, it is for covering the injured side or the pricked side, for it to prevent blood loss. It closes the other side. Then after covering it will stick to contain the sticker. It's made, and therefore you will no longer bleed, and you can move away when you are okay bleeding, when bleeding has already stopped. There are people who have bleeding disorders who can bleed continuously. You can go to one for self-testing, one for HIV self-testing. You test yourself or you test your partner. Also tear from the weaker points. And access the inner contents. Then after accessing the inner contents, first of all, there will be the guidelines for helping you to understand and follow step by step, so that you don't make an error. You can be keen and be accurate. Therefore, another part is a test strip, which is inside and also packed. Another thing, the other covering can be thrown away. The other thing is also packing. There's also another packing which contains other contents. For this one, you can use one of them. You don't use sure check. You cannot use one for sure and the self and Oracle. You also open the other kit. You access a strip like that one of malaria. Enough for this one has 3 chambers. It has a screen. It has a blood sample chamber, and it also has a buffer chamber. Therefore, you throw the covering. The other packing contains other contents, which is a buffer, which is colorless in color, and small fluid in amount. Also, there is another tool which is for cleaning, which looks like a toothpick. Another thing is also that one looks like a toothpick, and also a pricker. Then also a pipette for picking blood. Then you can pick also the alcohol swab. You clean the side and the ring finger. Then you throw it away. Then after you can pick the pricker. You remove the covering part, the upper part, the covering. After being removed, you place it on the clean part of the ring finger. Place it firmly. Then it will prick. There is a small prick that will prick you slightly. It will prick you slightly and worse. But because of pain, that's why he's changing the face. Then blood will come out as you squeeze. Then you pick your pipette and collect enough blood. Enough blood will enter. Then you put onto the side of the blood sample, the other middle part of the test strip. You can put enough blood. 10 microliter are enough. The other part next to the screen. Then the other one is a buffer. The other part, upper part is cut off, is pulled manually. Then after you will pick 4 samples, 4 drops, and placed on the buffer chamber. The last part of the strip. Put 4 drops. Then after you put on a flat surface, then the other part, which is like a toothpick like thing, is for cleaning blood, for removing excess blood. Then you clean as you wait for some minutes. Then you also put your timer. You time your time and wait for 15 to 20 minutes. Thank you. I hope you're following, and the speed may not be convenient, but however, now another test for this ones are used by the laboratory technicians. They determine. Also, it is peeled and blood is picked it is peeled and blood is picked technically. And for this one, everything comes aside. They are packing it may be a pack containing several test tubes for very many people. And these ones are not given to individuals. They are not given to individuals, but the laboratory is well equipped with everything, and everything is kept aside. Now you clean the site. After cleaning, you will clean the site. After cleaning the site, you will pick a pricker and remove the top, then pricks. After pricking, we'll remove enough sample. Removing enough sample, and we'll put on the other blood chamber, the sample chamber. And after putting on the sample chamber, now we'll go and get the buffer. Now after getting the buffer, you can put around 2 to 3 drops of the buffer, then the thing will run, and just wait for the same time, 15 to 20 minutes. Now in case it is positive, he will use to the next strip and use stat pack. If stat pack is positive, it means the patient is positive, and the positive thing is shown by viewing. And then finally, this is how results will appear. In case there is a single line, it means the client is negative. In case you see 2 lines, it means the client is positive. A line will form at C, and also another one will form at T. It means the client is positive. Now once it forms at only T, it means the results are invalid. Now once the data forms 2 lines, it meaning the client is positive. It means therefore you need to go for confirmation from a nearby health facility to confirm the positive results and be initiated on treatment.